If you're a nursing student about to take the NCLEX, you've probably heard about the huge changes on the horizon, or maybe they've already arrived by the time you see this. Next Generation NCLEX is the new and improved version of the nurse licensing exam, which many professionals, like Damien Jenkins of the Nurse Speak, have invested their entire careers in trying to understand and prepare students for. This makes the changes a huge deal, not least of all because it is the gateway through which every nursing student must travel in order to establish a career in healthcare. So today I will be talking with Nurse Damien to find out what Next Generation NCLEX is all about and how you can best prepare to pass it. How are the Next Generation NCLEX questions different to the outgoing NCLEX model?
So, honestly, it's not that different as far as the difficulty level that candidates are going to be tested with, right? So, the passing standard of the NCLEX is not changing, although they're changing a lot of the format for the questions and how they're presented. The biggest change really is that it's more of an advantage to the test taker than it is to the NCSBN. It's not a change to make it more difficult and make it more unattainable to get that license. But really what they did is they created almost like a layered approach at really measuring a candidate's competence. The old questions, which are still part of the Next Gen NCLEX, are only really focusing on the nursing process and then the 4 levels of difficulty, recognition, recall, comprehension, application, and analysis. But the new Next Gen NCLEX question types are offering a more layered approach where the test taker is going to be challenged not only on their ability to recognize, understand, apply, and analyze data, but they're also going to be tested. Do they understand the environmental factors that affect certain things? Do they understand the personal, like the individualized things that affect decision making? So it's offering a more comprehensive analysis of their competence, and with that, it's also offering partial credit, which is something that the current NCLEX test pan doesn't offer. You either get it absolutely correct or you don't. And with the Next Gen NCLEX, they're actually going to be offering partial credit when you select some of the correct answers, which is amazing.
It's a big one.
Yeah.
And the testing formats are still the same, multiple choice.
Yeah. So again, there are some new question types. One of the biggest ones that a lot of people are kind of wrapping their heads around, especially educators, to make sure they're implementing it into their curriculum, are like the case scenario based questions that are evolving. So you'll have a case scenario and you'll get multiple questions pertaining to that particular case scenario. And then they have multiple question types that are new to test takers that would ask them to place significance on certain things, or to maybe highlight key excerpts out of a progress note that would, emphasize that this is important information that I need to be focusing on. So it's just another way to challenge them to be able to identify that important information that should be considered a priority or significant clinical data that needs to be followed up on.
Okay, cool. So then what do nursing students need to do differently to be better prepared for Next Generation NCLEX?
Yeah, so honestly, I've been speaking this for 10 plus years, is that they have to make sure they understand the rules, principles, guidelines, and concepts that govern decision-making. Too much of our nursing education and supplemental resources focus on becoming a walking encyclopedia or a walking nursing textbook. And that's not what we need in order to produce nurses who can think critically and move through difficult situations. And so, as a nurse educator and understanding firsthand that it's becoming increasingly difficult to secure clinical sites because of the complexity surrounding our healthcare system, we are losing opportunities to have our students bedside with patients in practice under close supervision of a nursing instructor so that they can kind of put those pieces together and apply a lot of what they're learning. So that's one of the biggest downfalls of nursing education right now, is that we're not really securing all of the clinical opportunities so that students can really apply and analyze and grow into their role as a nurse. The NCLEX expects for people to be able to speak to that and to know what it's like to sit in the shoes of the nurse. You are taking the exam to prove your competence as a nurse, not your competence as a student.
Right. But it seems like that's the current model, right? You're a nursing student, you've just finished nursing school, and now you taking this exam without possibly having ever set foot into an actual clinical environment.
Yeah, and because of the pandemic, we all know that we lost tremendous opportunities for clinical and even skills lab. Even in a very simulated and controlled environment, we cut hours that were available to students just for safety reasons, for infection control reasons. So, the last couple of graduating classes, anywhere between 2020 and 2022, we have a lot of work to do to try to catch up these individuals. But really, the focus is knowing your roles and responsibilities as a nurse, making sure that you understand the concepts that govern decision-making, and practicing applying that information, really practicing these questions. There's lots of resources available that offer opportunity for you to answer these types of questions. And even if you're not familiar with the new format types, if you understand how to think like the nurse, then it shouldn't be that much more difficult than your standard questions you're familiar with.
Awesome. Excellent advice. The Next Generation NCLEX goes live on April 1st, 2023. What does this mean for all the test takers who are currently struggling to pass and you have to retake the exam after that date?
Yeah, I mean, it does pose an additional challenge, especially for those individuals who have been on a journey for years even to pass the NCLEX. They are going to have a little bit of a learning curve when it comes to these types of questions. And so, I would beg them to reach out to the professionals who are working diligently to make sure that they understand these question types and that they have an opportunity to help clarify anything about how to approach them. Again, the difficulty level of answering these questions correctly is not changing from standard question types. But if you've never answered a case scenario type question and see that it's evolving and the new matrix and the extended SATA and all of these different options that they're including, it could be very overwhelming and frustrating for someone. So I would say it's inevitable. If you haven't passed the NCLEX by March 31st of 2023 and you're taking it again, it will be the Next Gen NCLEX. You have no option beyond that. But there's lots of us out there that can help you prepare.
Yeah, that's great. Well, in the face of national nurse shortages, why has the NCSBN decided to roll out the Next Generation NCLEX?
I've gotten that question a lot. And some of the people who ask me that question are very passionate about, the fact that they could have postponed it. And, I've attended a lot of the conference and I've listened to a lot of their meetings to kind of really from their perspective to see what it is. Why didn't they push it back? And the real reason is that they've been researching this level of measuring competence from a standardized test taking perspective. And for 10 plus years, they've just collected so much evidence that clinical reasoning and critical thinking is the foundational problem with our new graduate staff. That most of the errors happen from new grads because they haven't developed those critical thinking skills yet. And so the NCLEX really felt that it needed to level up the opportunities for new entry into practice, candidates to say, hey, I have the skill set to be able to think critically and apply and analyze these concepts, because despite where I land, when I start my first job, whether it's the ICU or a pediatric unit, I should still be able to think critically and perform well within my roles as a nurse. And so that's why they decided to roll it out despite a lot of people's plea for we're in a crisis, because at the end of the day, their research shows that the passing standard is not more difficult. It should not create a major gap in pass rates. If anything, it's the fact that we've lost a lot of opportunity for clinical and the skills lab that's going to create that dip in pass rates. I don't think it's the new testing format that's going to do that.
And I see now why you say it's actually benefiting test takers, because ultimately, would you like to face this difficulty now when you're studying for an exam, or in the clinical environment when someone's life depends on it?
Exactly. I say that, and thank you so much for saying that. That is so important. You want to make your mistakes in practice, right? You want to make all of your mistakes in practice. That way you don't create that harm, because that's the whole point of this exam. Now, by no means am I saying NCLEX is the definition of nursing ability or competence, because it's not. It's a standardized exam that tests a very specific capacity of new grad nurses. It doesn't measure bedside manner. It doesn't measure compassion. It doesn't measure intention, right? But it does measure critical thinking capacity, which is so essential for safe practice. So yes, thank you for saying that. You want to make your mistakes when you're practicing, not when you're with real patients.
Yeah. Well, how does your brand, the Nurse Speak, adjust for Next Generation NCLEX? And how are you helping students and educators to prepare for the coming change?
Yeah, so, I've been doing my due diligence and attending as many workshops and conferences and speaking to the good folks over at the NCSB, and to make sure that I fully understand how the next gen is going to be challenging test takers. And since 2016, I've been helping people pass the NCLEX. And so I'm transforming my program. The beautiful thing is I don't have to rewrite anything. I just have to add a few things that are specific to the different question types and the different kind of challenges when it comes to answering case scenario type questions and these highlight kind of progress note questions, which is a different method. And so I'm making sure I'm including all of that into my products and services. And I've actually worked with several universities now to just kind of be an extra set of eyes to make sure that what they're developing is meeting the criteria of Next Gen so that their graduates will be successful.
So that's what you need to know about Next Generation NCLEX, straight from expert Damien Jenkins of the Nurse Speak. If you have questions for Damien or would like to enlist his NCLEX prep services, I encourage you to reach out to him directly through his website and social channels. You'll find the details to those below in the show notes. Nurse Damien also helps nurse educators, tutors, and schools who are in need of guidance regarding the latest NCLEX changes. So if you're in that boat, I encourage you to get in touch. You are studying to become a registered nurse or nurse practitioner, make sure you get Brainscape's NCLEX or nursing flashcards, which will help you study so much more efficiently and keep up that healthy cadence of daily review that is so essential for doing well in these content-heavy subjects. For even more guidance, check out the other videos we have on Brainscape's nursing channel and go to the Academy for A to Z study guides on how to excel in nursing school and beyond. These tools, together with your ambition and hard work, is everything you need to rise to your challenge.